This is the amendment to establish the SA Public Health COVID-19 Direction, Accountability and Oversight Committee. The intention behind this amendment, Chair, is to ensure that there is maximum accountability and transparency in this bill. Like the Honourable Connie Benares, we had very clear feedback in the Greens that were a bill like this to be legislated, it was really vital that the Parliament have the opportunity to disallow new health directions. And that's what this committee does. It's a powerful committee in that it has all of the powers that a usual parliamentary committee has, but it will be able to review any new health directions relating to close contacts, relating to COVID-positive people, and be able to make recommendations to the Houses of Parliament for disallowance. This, we believe, Chair, is a much more effective way of managing the pandemic directions in the long term. It provides an opportunity for Parliament to really consider the impacts that these restrictions have on the health and well-being of South Australians. It's been based on the Victorian model, which is widely regarded as best practice. We understand there are, of course, some distinctions based on our different jurisdictions. It's important to note that South Australia doesn't have a human rights charter to protect human rights, which is something the Victorian legislation has protected. And obviously for us in the Greens, we'd love to see a human rights charter being put in place, and that would be a very good accompaniment with the other legislation that we're dealing with. This committee will be made up of 5 members, from, that is 2 from the House of Assembly and 3 from the Legislative Council, and the amendment would ensure that there is not a majority, that there is a majority rather of non-government members. I think that's a really important inclusion worth highlighting, Chair, because that means that the government is not in a position to dominate this committee. It means that the committee will be able to provide frank, fearless advice, genuinely independent advice, direct to the Parliament for its consideration. The committee will only be in place for the duration of the bill. We agreed earlier today that that would be 6 months. It will provide reports to each Houses of Parliament. It will make recommendations to Parliament. And also there's a requirement that the Minister will table a copy of any directions within 2 sitting days in each House, and that any such direction is then referred to the committee. And as I stated, this allows for disallowance in both Houses. We think this is a really important addition. It's one that will provide better outcomes in terms of directions, but I think also give the South Australian people a level of confidence that the Parliament is having oversight over these important directions. We've talked a little bit about the evolving space of this pandemic. We've come out of the phase where these decisions were being made by health experts alone. We're now moving into another phase of the pandemic where politicians and the Parliament need to be more actively involved. And it's only appropriate that if the Health Minister is being charged with making these directions, that the Parliament has a role to play and that there is an independent oversight that operates outside of the government. And we think this is a really important step in that regard.